All right. All right, so we're live. So this afternoon's discussion will focus on the film Donnie Darko. So there's no right answer here. Is there any particular character you'd like to initially focus on?
Well, it might not be a bad idea to start on Donnie.
All right, so where do you want to start? What you observe?
Well, it's a little bit tricky. I don't know. Maybe let's pretend for a little bit that the ending didn't happen.
That's fair.
And just kind of take it at face value for the majority of the movie. Obviously in the movie, his therapist says that he has paranoid schizophrenia, which I don't think is actually the correct terminology anymore for what that is. But definitely schizophrenia with some
Paranoid delusion.
paranoid.
He definitely has delusion.
Right.
Yeah. So for the diagnosis of schizophrenia, even before we get to the subtype, right? To diagnose schizophrenia, we're looking at an individual who has two of a set of 5 symptoms as published in the by the American Psychiatric Association in the DSM. So let's start with a clean slate. What are the 5 diagnostic criteria, often referred to as the A criteria, for schizophrenia?
Hallucination.
Hallucinations,
Delusion.
delusions, disorganized speech or thought process, disorganized or catatonic behavior,
And negative symptoms.
and negative symptoms, right? So the first 4 you named are positive symptoms, right? The usually hallmarked by the pathological presence of something that at baseline should not be there. So right now, nobody in this room should be experiencing hallucinations. Right now, if you are, it's a positive symptom. The final symptom that you provided are negative symptoms as a group. Any one suffices to rule in for that criterion. The absence of something or the pathological absence of something that at baseline should be there. So any examples? Yeah, flat affect. Right. So individuals should have a normal and broad affect. And when the intensity is below normal, below average, we will call it blunted or flat. And certainly affective flattening would be an example of a negative symptom. All right, so does Donnie rule in at this point?
He has the hallucination.
Yeah, he has hallucinations
And he has delusions.
and he has delusions. Does
I
Donnie
don't think
rule
he
in?
really has a disorganized speech.
Maybe disorganized behavior because of the things he's doing without fully realizing or understanding why he's doing them.
Yeah, the behaviors, plural, do seem to be spontaneous and not well planned.
It's like when he was talking to what ended up being the guy the guy that he set his house on fire. Like that speech when they were in the auditorium, just a very impulsive kind of frantic.
Yeah. So I agree. No, I agree. And he does have a flat affect as well. So he may have 4 of the 5 symptoms. So absent the actual disorganized speech or thought process, he may have every other symptom defining schizophrenia.
But it's also a question, I mean, getting into then the actual criteria, it also depends on the time, right?
So
And
that's the next question.
The movie doesn't necessarily take place over a full month. But like,
But before we go there, though, there's still there's one step before we actually talk about that, and that is the the appreciation that this condition called schizophrenia is actually a diagnosis of exclusion, right? So the American Psychiatric Association does list 5 illnesses that the clinician must investigate and exclude before ruling in schizophrenia. What are those 5 illnesses?
One mood disorder.
One is a primary mood disorder. Yeah, somebody presents with a mood disorder. with co-occurring psychiatric features or psychotic features, the mood disorder actually takes precedent over the diagnosis of schizophrenia. Mhm. That's one, 4 more.
Substances.
Yeah, a substance-induced psychotic disorder would be investigated. It's 2.
Medical causes.
Yeah, that's
or
like,
syphilis, hypothyroidism.
that's 3.
Does trauma fall in medical causes?
It does not, but it is not included in the short list. Number 4 would be schizoaffective disorder, which is another psychotic disorder. That would take precedent here. And then the final one is an autism spectrum disorder. Because of the overlap of disorganization of thought process as well as behavior. So, do either of these or any of these are any of these supported in the film Donnie Darko?
I mean, he does like smoke cigarettes and drink alcohol, but it doesn't seem to like extent where it causes psychosis.
Yeah, and whereas tobacco would not be able to induce psychosis anyway, it doesn't matter if Donnie smoked 2 or 3 packs a day. Donnie Darko, the film, cannot possibly be about tobacco-induced psychotic disorder because the APA doesn't recognize tobacco-induced psychotic disorder. Tobacco cannot, just doesn't have, does not change the neurobiology to result in psychosis. Alcohol does, however. Alcohol can induce psychosis both during its intoxication phase as well as its withdrawal state. And then other mechanisms as well. So there's usually 3 ways alcohol can actually induce psychosis or a psychotic disorder. I guess we have to leave that in our differential, even though I'm not so sure we will buy into this being, that is Donnie Darko, the film, being a case study of alcohol-induced psychotic disorder. But it's, and there's other substances that certainly show up in this film, albeit not used by Donnie, including stimulants, including cannabis, each of which can induce psychosis.
There's also, like, I wanted to ask about every time he takes his medication, at least that I noticed, that like that almost induces the hallucination. So there was a question in the back of my mind of exactly like what is he taking that induces these, for Frank to appear. Is that how I remember it, is that happened almost every time, like he had these like really vivid hallucinations after he took that.
And that it always happened
Every night, yeah.
Yeah, and there's a couple of ways to look at this, the chicken and the egg. One, is this medication prescribed PRN? So is the fact that he's hallucinating just related to or correlated with the medication? There's really no causality then established. So the reason why he's hallucinating is the very reason why he's popping the pill. On the other hand, it could work in the other direction as well. Is he taking a dopamine agonist? Is he taking something that would increase the relative or absolute level of dopamine in the central nervous system, resulting in positive symptoms?
Also, like maybe it's not titrated well, and it just happens that like he takes his medications every night as he's like under therapeutic levels,
Or
and
just
then
the
it
wrong
has an,
medication
I don't
together.
know. What's that?
Just the wrong medication to
Yeah, I
begin
was
with.
gonna say,
Yeah.
maybe because like when there was the scene where the parents come in, asking, we want to know what's wrong with our son, if maybe previously it had been misdiagnosed as like a mood type disorder, that now as she kind of figured out prevalence of these hallucinations and through the hypnosis and that it was schizophrenia. So that was my other.
Well, using that as a segue also, she, elucidates from the sessions that a big primary thing in this is his fear of being alone and like a fear of these things that he can't control. So it is difficult to determine if maybe he has like MDD as a result of those feelings, as like psychosis and psychotic features.
Yeah. The other part of this too is that the signs and symptoms that may have resulted in his being prescribed an antidepressant may have been misdiagnosed. That is, it could be a prodrome to schizophrenia. And then you add the antidepressant on, and maybe one that enhances dopaminergic activity, like bupropion, that then exacerbates, which then ties in why every time he seems to take a pill, he sees Frank. So there might be something there. And my gut, just looking over the mechanisms of action of the antidepressants, is that bupropion would be at the top of my list. Now, I know that we see the pill bottle, we don't see the label. So a little bit of a tangent here. Generally speaking, when it comes to prescribing antidepressants, we have a choice when it comes to first line agents. So just if someone were to present with depression, so I'm not trying to fool you, this is not bipolar, this is not any other illness, this is major depressive disorder. What medication are you likely to prescribe? Yeah. So the good news here is that you could have blurted out anything, and you did, and you'd be right, because all of our antidepressants are equally effective, right? Outpatient studies show that there is a 50-50 chance that you will have someone have an initial response that is to the first medication that you choose. So equally effective. That's across all the categories of medications. So let's just briefly review the first line medications. And certainly with this review, we'll end up talking about bupropion, right? And that's probable medication or possible medication that the therapist actually prescribes Donnie. You have your serotonergic agents, you have your non-serotonergic agents, and then you have your combination agents. Okay, so let's make this real easy. The serotonergic agents really come in two categories or two subclasses. The first are the SSRIs, which I heard as pretty much the majority opinion here. There's another illness. No, there's another agent, Deserel, otherwise known as trazodone, that also works through serotonin. Now, trazodone is as effective as any SSRI. Unfortunately, because of the side effect of fatigue, it's designated primarily as a hypnotic, as a sleep medication, albeit off-label. Usual doses that one needs to achieve for Deserel is 400 milligrams, and individuals can sometimes be put to rest with as little as 50 milligrams. So tolerability usually designates the SSRIs within the serotonergic class as a primary agent. But it has nothing to do with efficacy. It's tolerability. You have your non-serotonergic agents. These agents primarily work on some combination of norepinephrine and dopamine. And this one would be bupropion. Right. And then you have your combination agents. Combination agents can work at the level of reuptake. That is blocking reuptake of both norepinephrine, I shouldn't say both, dopamine and serotonin, result in the antidepressant effect. Such agents would be venlafaxine or desvenlafaxine, also Cymbalta, which is duloxetine. They could also work on a receptor level. And at the receptor level, we have mirtazapine. Again, dopamine, norepinephrine, and serotonin. So combination agents. Right. All that said, every agent that I named, every medication from the different subclasses that were very briefly reviewed, are equally effective. Right. In this case, it's a very rare side effect that you can induce psychosis from an agent like bupropion. However, in someone who may be misdiagnosed as having depression, but instead prodromal to schizophrenia, it could happen, and maybe that's what we see here, at least with the time course, the temporal relationship between the time Donnie actually is seen taking a medication and then is subsequently seeing Frank. Questions about antidepressants?
There's one in the live.
What do you
What's mirtazapine for?
Mirtazapine, they're antidepressant. Mirtazapine is Remeron, and that's just another antidepressant. Everything we named here is antidepressants.
Is that a TCA?
Nope, all first line. Mirtazapine is a combination drug, antidepressant that works at the receptor level instead of at the level of reuptake. So in that way, it is a little different than either duloxetine, venlafaxine, or desvenlafaxine. Any other questions? What other observations?
I have one just as we were talking about, the fact that he sees Frank at night. I'm also wondering if there's a temporal association to his hallucinations, and so sort of this like cyclic rhythmic, like pattern to him. And that was just about that.
Yeah, so I mean, if I were the writer director, my gut is that it's a little spookier at night. But if we're going to medicalize this, if we're going to see this through the lens of a psychiatrist, one of the first things, and this is getting back to what we already discussed, or at least introduced, and that is that we have to rule out a general medical condition as inducing the psychosis. And in those cases, one of the general medical conditions that we have to consider, although it's a broad definition, is delirium. And in that case, I would expect delirium to be much more prevalent at night when individuals lose the visual cue and therefore see things or hear things that maybe others don't see or hear. Right, so that's a consideration here. I don't know if Donnie Darko, the character, is delirious though. I think we could rule out delirium. I don't see him as being confused during these states. He is articulate, he is coherent. And therefore, and he seems oriented. Nobody really asks him, where are you? What time is it? But he does appear oriented. So I don't think delirium would be very high in our differential. Other observations?
I think that there's,
Do we think it has anything to do with sleep and sleep deprivation, that he's having some hallucination?
So, yes and no. I don't think I would focus on sleep as creating a differential diagnosis here. I know that the movie starts with sleepwalking or what appears to be sleepwalking, but I think in retrospect, when we see other evidence, when we hear more of Donnie's story or more of Donnie's story is told, his apparent sleepwalking is really disorganized behavior in the context of a psychotic process. And it's very similar in that respect to Lady Macbeth. And everybody thinks in the Shakespearean play, during the infamous scene, that Lady Macbeth is sleepwalking. She's not. She's delirious. And in this case, Donnie is not sleepwalking. He's not delirious, but he is psychotic. And it might be a psychotic break. And it might be a first break psychotic episode.
is there an aspect of like dissociative identity disorder as well? Because he doesn't remember himself doing these episodes. It's only like after the fact that he puts together that it was most likely that it was him.
So no, however, during psychotic breaks, during periods of psychosis, individuals may not integrate memories and they may have interrograde amnesia. So there's probably some dissociative amnesia with respect to the psychosis, but I would not tease that out as a separate disorder. So number one is that I don't think Donnie Darko is suffering from dissociative amnesia in addition to what looks to be schizophrenia. And during the dissociative episodes, I don't see him as actually taking on another identity, a distinct personality state. So I don't think it's DID either. Emerging evidence, up to 80% of individuals with a psychotic disorder report episodes of dissociation. So there's significant overlap between these two conditions. And that's vice versa too. Individuals with dissociative amnesia and DID report psychosis more than 50% of the time.
So we can attribute like the fugue-like behaviors where he like wakes up in the golf course to the psychosis as opposed to.
I think so. Yeah, I think it's disorganized behavior. I don't think there's purposeful wandering away, and I certainly don't think he assumes a new identity. So I don't think it's dissociative amnesia with fugue. By the way, I mean, just because we're talking about this, you've named almost every condition within the dissociative disorder chapter. So a chapter related to, but distinct from the schizophrenia spectrum and other psychotic disorder chapter. You've named DID, you named dissociative amnesia with fugue. And it's probably noteworthy to identify that the substances that can induce psychosis are the same exact substances that can also induce dissociation. Matter of fact, in the most latest edition of the DSM, the new title is simply substance-induced psychotic disorder. The APA did away with substance-induced dissociative disorder, because they're one and the same as far as substance induction is concerned. You named 3 of the substances already. You named alcohol, we referred to cannabis as well as stimulants. There's 2 others that can induce psychosis, and just to cover our bases, we may as well just finish that short list. So 3 others, I'm sorry. So okay, anything alcohol can do, benzos can do as well. There's one exception to the rule when it comes to anxiety. But yes, benzodiazepines do work here. Now there's 2. Now there's 2 more left. Cannabis is one of them, yep.
LSD or like.
Hallucinogens are the other. And there's one more, it's inhalants. Right, so those are the 5, 6, if you include benzos, yeah. Right. And again, all 6 induce psychosis and dissociation. And by the way, delirium too. So you can clump those 3 together when it comes to substance induction. All right. What is the other dissociative disorder then that we missed?
Depersonalization, derealization.
Exactly what it is. Depersonalization, derealization disorder. The subjective sense of depersonalization and or derealization. It's got the easiest definition in the world. That said, we probably should contribute just a couple of seconds to what depersonalization and derealization are. So what is depersonalization? Subjective sense that you or part of you is unreal or disconnected in some way. Depersonalization. Okay, so the out-of-body experience would be now, yeah.
Is it similar to like his hands doesn't belong to me?
Yeah. Oh, yeah, that would count. Yeah. Oh, yeah. Yeah. And then derealization is the very similar type of experience, but attributed to the immediate environment, not oneself. So the subjective sense that your immediate environment is somehow unreal or disconnected. So feelings of deja vu. Okay, and before you even ask if you've experienced deja vu, no. Yeah, right. Yeah, no, the answer is no. You are not mentally ill. If you experience deja vu recurrently and it is resulting in clinically significant distress or impairment, it's potentially due to a mental illness. And the mental illness that would be highest on the list would be depersonalization, derealization disorder. By the way, the scenario that you described with,
With a neuro, like a different.
and again, that could be due, and I don't know where the lesion is, I probably should, but I don't know where the lesion is, but that's a neurologic condition. There's a,
It's like a frontal lobe lesion, right? Where you can have like neglect, so you can also think that like something, a part of your body isn't up, like your.
Yeah.
Oh, yeah, like if they shake you, they like bring your hand into the field, like whose hand is that?
I think it's like a non-dominant parietal lobe.
Right.
Oh.
Let's say though, the MRI, CT scans are all normal, right? Because again, we have to think this way for any mental disorder, including depersonalization, derealization disorder. Let's say that's not due to a known neurological or medical condition. Then depersonalization, derealization disorder is the single best answer. And for that particular scenario, horror movie that depicts it. No, splatter horror. No, huh? Okay, we'll get back to that.
Is it American Psycho? Is that
It's not American Psycho.
the splatter made me think of American Psycho.
That's a great guess. Great movie, but no, we'll get back to it. It's the reason why I wanted to ask as you brought that up. But we'll tackle that one in a little bit. All right, other observations for Donnie.
I guess just going back to like your question about like the differential broadly. I mean, to what extent could we like potentially say this could be a manic episode with psychotic features? Because I think there's like a lot of overlap with that presentation in this one.
I agree. No, I don't think we could definitively say that it's not. Mood disorder, whether it's bipolar or depression, takes precedent. Okay, and while the rates of psychosis within depression are up to 20%, they're up to 50% for individuals who suffer from bipolar illness. So that's something we have to keep on our radar. A primary mood disorder that is bipolar 1 would definitely be in a differential here, and there's no way we could definitively say that we're ruling this out. There's also a comment, okay,
And you wouldn't really treat them that differently, would you? I mean, because, I mean, I guess you wouldn't commonly give a schizophrenic a mood stabilizer necessarily. But in this case, like, I don't know, if we wanted to treat Donnie Darko, it wouldn't be maybe a bad idea to put him on a mood stabilizer as well as, you know, an antipsychotic.
right, well, and the good news is that there are multiple antipsychotics that have been FDA approved to treat mania within the context of bipolar 1. So the safest bet would be to go with one of those agents. So if you're wrong, you're still at least pick the right medication. Now, there's other aspects of treatment that unfortunately can cause some untoward effects. But at least with regard to medication choice, choosing a second generation antipsychotic with the additional FDA approval for bipolar mania probably would be the best way to go because of that. There's a comment by his father in this movie. And I really don't know what to make of it. I think they're driving and he makes a comment about how when he was young, you know, he was kind of and I forgot the word he used as well, kind of an outcast as well. I just wonder if this parallels our getting collateral information, family history, and whether or not the father actually had a similar episode when he was young. And if that's the case, and certainly observing the father's behavior in this film, he does not appear to have schizophrenia. And therefore, his psychosis may be more or due to an episodic illness. And here he's he's inter-episode. And maybe that illness is bipolar. And there's a significant heritability, right? Bipolar, like 60% heritability factor. One of the most heritable disorders that we have in psychiatry. So it's one line. I'm probably reading a little bit into it, but it's something that I think we would query. Any of these other differential diagnoses we have to discuss. So we talked about substances referred to medical conditions, primary mood disorders. And because of the mood element, of course, schizoaffective disorder now remains in our differential as well. Both primary mood with psychotic features, as well as schizoaffective, are in a slice of time are going to present looking very, very, very similar, right? Only the history differentiates one from the other, right? In one situation, the individual or collateral information is going to provide a history that the individual is psychotic for an extended period of time, absent mood. That establishes a primary psychotic process and therefore schizoaffective disorder as a single best answer. And when the opposite is true, when the history allows for a time frame of sustained either depressed mood or manic, absent psychosis, well, then it's a primary mood disorder and therefore either bipolar or major depressive disorder with psychotic features is the single best answer. So the history is going to be able to differentiate the two, which is not always easy. The only condition we have to consider here before we continue our ruling in an evaluation for schizophrenia is an autism spectrum disorder. So in Donnie Darko, the prequel, if he had established, and there's no such thing, if he had established autism spectrum disorder, would this change what we're doing today?
Yes.
Why?
Well, what do you mean change what we're doing today?
No, I would still make you around this table discuss that. I don't want to go that far. But in terms of the way we're formulating this case,
Well, because like we said at the beginning, that schizophrenia is a diagnosis of exclusion, then and autism can be excluded because it's known that he has that, then it does change.
Right. And why is it that the APA requires clinicians to investigate autism spectrum? Why is it that it is a diagnosis of exclusion?
It's treated differently.
It definitely is. Anyways. Overlapping symptoms. Right? And they are what?
Organized speech. Behaviors.
I guess it would probably be what we consider for the disorganized speech disorder.
Right.
Behavior, right?
Mhm.
People who have a diagnosis with autism spectrum disorder, it's not, it may not be a disorder.
That's right. Mhm. Mhm. So in this case, and the point I want to make is that individuals who come in with a pre-existing condition, autism or autism spectrum disorder, ASD, who have new onset hallucinations, who have new onset delusions, can be diagnosed with schizophrenia because those two positive symptoms would not be explained by the pre-existing condition. And that's exactly what's happening here. So even if the prequel to Donnie Darko established that Donnie is afflicted with ASD, we're still having this conversation because you, about 20 minutes ago, identified and expressed concern over Donnie's delusions and Donnie's hallucinations. And so it really wouldn't change what we're doing. All right, so with that as our differential at this point, now we have to discuss whether or not there is anything else to consider beyond which the APA mandates. So we did the mandatory stuff, right? The idea of this being a diagnosis of exclusion. At this point, and this is the mental test. If you were to have nerded out and taken notes on this movie and crossed off everything on your notes page that we just discussed, would there be anything left? Because if your answer is no, that means we've discussed all we can and everything is explained that has been observed. On the other hand, if you're telling me there's still stuff here that you want to discuss pertaining to this character, then we have more of a differential to discuss here. And that differential then will expand beyond the actual definition of schizophrenia itself.
At some point, I was thinking about the possibility of something like a conduct disorder because it's established that he had burned down a house in the past. He burned down a second house in the film, he flooded the school. So that was something that I was kind of thinking about potentially.
No, I think that's got to be in our differential diagnosis. I certainly want a history here. What if, though, mom, dad both tell us that Donnie has not had those types of behaviors prior to the age of 15, which is what we need to establish conduct disorder? How do we make sense of him breaking the water main and flooding the school and setting fires?
Antisocial personality disorder, is that what you think?
No, because without established conduct, we can't say it's antisocial personality. So I think first and foremost, the first place we have to look is whether or not these behaviors were manifest during episodes of psychosis. This might be his psychosis. Now, again, that might not be easy, but that's the first thing we have to consider. That he was actively psychotic. Was he entertaining command hallucinations? Did he have other delusions as to why he thought he had to do what he was doing? So I would attribute it to psychosis. There's also, and this gets to, I just mentioned delusions, right? Or even auditory hallucinations, command hallucinations. But there's another positive symptom, communication, right? Thought process, speech, and communication. There's a condition called communicative arson. And this would apply to breaking or other destruction and damage as well beyond setting fires, where individuals who have a difficult time putting words to their feelings and expressing themselves do so through nonverbal communication. And sometimes the nonverbal communication can be violent. So I have no doubt, especially during a psychotic break, that an individual might resort to setting fires, flooding schools as a way to communicate something. All right, so that's another consideration here as well.
How is communication arson different than pyromania?
So in pyromania, it's a great question, and this will come up on a shelf exam. If not now, some certifying exam, since everybody here I think is going into psychiatry. But first of all, congratulations. That's wonderful news. Dr. Ilaria told me that. Thanks for sharing that. So in pyromania, in fire setting, the individual will often explain that they have this urge, this impulse that just comes out of the blue, and it's irresistible, and they are compelled to act on it. And as they act on it, their anxiety goes up, and as they get closer to completing the act, and that would include maybe even stealing, that's kleptomania, their anxiety peaks, and then as soon as they commit the act, the anxiety rapidly de-escalates. So that's something that's very common and very consistent in what were formerly known as the impulse control disorders, such as pyromania and kleptomania. That's not the case here. This is someone communicating to you. There's no impulse, there's no resistance that is overcome, there's no anxiety built up, there's no anxiety de-escalation. None of that is true here. And that's by far the major difference. By the way, there's another condition that is usually clumped with this, pardon the pun, is trichotillomania. Trichotillomania has been taken out of this chapter and placed in the obsessive compulsive and related disorder chapter. So now trichotillomania or hair pulling disorder, similar to skin picking disorder, is now considered to be on the spectrum with obsessive compulsive disorder.
Why, okay, so why even though like in pyromania, they have that, I mean, I guess maybe it's not a compulsion, but that's kind of what it sounds like to me. Why is that impulse control versus like compulsion? I guess, I don't know if that's like getting into the weeds too much, but I was just curious.
No, I
about
think
that.
the bottom line is that the literature says so. So this is all what the literature provides us, and over time, the literature might actually change the minds of the American Psychiatric Association. It certainly did with trichotillomania, where we, for years, up to 2013, thought that this was an impulse control disorder because of that, if you want to graph it, that set of events that I explained before, the impulse coming out of the blue, the resistance to the impulse being overcome, etc. Until just prior to 2013, it wasn't. All of a sudden, the literature showed that what was really going on in people's minds were what looked to be much more consistent with obsessive compulsive disorder. Hence it left one chapter for the other two still remain, and who knows the way the evidence is gonna or where the evidence is gonna go and take us the next decade or decade plus. I'm not sure if I answered your question.
Yeah, that is.
All right, other observations in Donnie. I mean, getting back to our questions, anything else going on here that needs, so we said, I mean, there are some antisocial traits here, but there's not firm evidence of conduct disorder. Again, we don't get to see the prequel. We're good. It settles it for Donnie. All right, well, any other characters you want to discuss as part of this case study called Donnie Darko?
Grandma dead.
Grandma death. Observations.
Very elderly.
Mhm.
Well, I think there's like a big question of whether, you know, in her life, people's schizophrenic as well. Given that like there was, at least how I understood it, was that book that she wrote was describing the same kind of visual hallucinations that Donnie was having. So, you know, on her work with time travel, is that just a huge hallucination? You know, was she in fact, well, she was a scientist or according to, but you know, I think exactly like how real she is. Also was something that I questioned, but definitely, you know, did she have the type of schizophrenia that Donnie also potentially has?
I agree. I mean, I think at first glance, because we do identify her age, we in our differential, we think of major neurocognitive disorder, otherwise known as dementia. But then we're given the history that she was once a nun and then left the nunhood, left her studies to pursue something else, and then went down this path to where she is now. So whatever it was certainly predates the onset of her being 70 or 60, which means that this is not likely to be dementia. And there probably is something else going on, and I think very high in that differential would be schizophrenia as well.
And also, like, we don't know for sure if she had hallucinations. This could have been just a more kind of like a magical thinking kind of ordeal. In which case, you know, again, depending on the history elements, we could think of like a schizotypal personality disorder. But I think also the fact that she was a nun and then left suggests, you know, depending on how, like her age when that happened would be more suggestive of something like schizophrenia and the declining, functioning.
Yeah, and it's a good point because that comes up, Donnie Darko won't, but that comes up on shelf exams, and that is individuals 18 to 25 who are in their studies and then drop out. Right, so that's the pathognomonic path where schizophrenia is the single best answer, right? It's usually somebody in college or graduate school doing well, grades begin to decline. Maybe some descriptive symptoms that are consistent with depression, but that's the prodrome. The case vignette may not even give you any psychotic features, right? But that's the pathognomonic onset. And it's an onset that we can see play out here with grandma death. With Roberta Sparrow. Yep, so maybe schizophrenia. I don't think it's dementia, but we do need to talk about major neurocognitive disorder, and we need to talk about mild neurocognitive disorder. So what differentiates the two?
Mild neurocognitive disorder does not meet the criteria for major.
I can't say you're wrong.
I think one like significantly alters one's ability to perform activities.
Yes.
on a daily basis, Whereas
That's
the
it.
other one is like on a little bit forgetful, but it doesn't significantly interfere with their ability to do basic. everyday activities.
That's exactly right. So the signs and the symptoms, the actual diagnostic criteria are exactly the same. What differentiates exactly what you said? One is clinically significant, and one is actually defined as not being clinically significant, which is the only time that occurs other than in one other illness. So what other syndrome is literally defined through its not being clinically significant?
Hypothyroidism. You can have like a subclinical hypothyroidism.
In psychiatry?
Oh, not generally.
Are you talking about
But you're right.
hypomania versus mania? I don't know that I understood that.
No, you understood it. You're right. Say it louder.
Hypomania versus mania?
Yeah, the signs and symptoms for hypomania and mania are both dig fast. What differentiates hypomania from mania is that mania is clinically significant. That is, it causes clinically significant distress or impairment, while hypomania does not. Right? It's literally defined as not being clinically significant. Right? So those are the only two conditions: hypomania and mild neurocognitive disorder. Good. Anything else about Roberta Sparrow?
One thing that I was wondering during the movie was that I was wondering about the correlation between the actual hallucinations that Donnie was seeing as well as what was in the book. Because one thing Donnie said a few times is like it can't be a coincidence, because of how it seemed like there was a really strong correlation. And so I was wondering, to what extent did him reading the notebook influence the hallucinations that he was later having for him to feel like there was a connection there?
Yeah, or yeah, sorry. go ahead.
I was just gonna say, or was it all real? And it's,
Yeah.
and it's just science fiction, and he did actually go back in time, and he did actually see all that.
Well, again, when in doubt, I want you to put yourself in a position where you're on call and you're attending. And a person like Donnie presents with everything that is the plot of the film they star in, that's Donnie Darko. And now I'm gonna pimp you.
Present to you, yeah.
I'm gonna say, listen, what do you think's going on? If you tell me that, no, this dude's time traveled. And he's
So you're
being,
gonna consult.
yeah, then that rhyme P is gonna be a little bit of a task. But you're right, yeah, and I actually, for this movie, certainly I want to get into that a little bit, right?
I was gonna say, I don't think it's that like surprising, because I think a lot of times with like patients with schizophrenia spectrum disorder, they tend to say like, oh, like I was getting messages from like the TV or the newspaper, so maybe just the kind of like what he was reading and saying that it made sense and resonated with him was just kind of like similar to that kind of symptomatic.
But he started seeing those two paths out of the chest before he even got the book and saw Roberta's pictures in the book.
I guess, but also like the temporal component of the movie is shaky. the narrative is very chaotic, so I feel like you can't really establish like what comes before
Sure.
something else. That would be my argument, but you're right.
And again, a nice parallel to our live patients report, right? Sometimes it's very difficult to establish timeframes. And then someone with a psychotic disorder such as schizophrenia, that's actually a cognitive deficit. They have a very difficult time when provided, the standard H&P, the standard psychiatric assessment, providing the answers to you in the context within which you ask them. So you might be asking about the HPI, but they might be talking about a suicide attempt that occurred as part of their past psychiatric history. Right, so very difficult. And it's interesting, maybe even ironic, that I know that in a prior grand rounds, this is well over a decade ago, there was a comment made, and I mean, it was just more than a comment. We actually got into a little bit of the science behind it, the research behind it, but that people with schizophrenia have a very difficult time understanding time travel. Right, and the idea is all about time frames. Right, and so it's a very challenging history to sometimes, especially someone who's acutely psychotic.
I also wondered if like he identified with grandma death as his future and therefore took on whatever kind of teaching she had taught because he saw himself as like, there's something wrong and like I will end up being like alone walking the street, like doing something like that. So that was also something that came to mind. It's almost like a identification with that is what his future would be.
Yep. No, I agree. And whether it's the book, whether it's the author, what we're seeing here is that we have a character that is taking personal or believes things are personally significant to him. That is often referred to as our idea of reference, which is consistent with the very illness we're talking about. So things are taking on a very personalized significance for Donnie, whether it's the what or who Roberta is, what she's currently doing, or even aspects of the book speak to him or are made or authored for him. Characters other than Donnie and Roberta.
I think her name was Kitty, the gym teacher / dance mom. I was really trying to figure out what she had because I feel like she's got to have something, and it's just like kind of difficult really to tease it out. It's not quite like erotomanic delusions because it's not. She doesn't necessarily believe Patrick Swayze's in love with her, but she's like obsessed with him in certain ways. I feel like she is delusional about some things, like how she said, "Oh, because the English teacher, assigned this book. That's why we had this episode of vandalism at the school." I don't know. There's a lot of stuff like that. I just kind of want to open up.
Yeah, I'm not sure. I don't know if I would say totally like histrionic, but maybe some feature just to like the dramatization of these seemingly kind of mundane things. And even towards the end of the movie, I think she's talking to Donnie's mom, like I can't go with like the dance team and like you have to go, but she just kind of blew it so like out of proportion. I don't, yeah.
Well,
she's very
there's also some,
yeah.
there's also some like borderline stuff, and that's like I guess the splitting of the fear and the love, and everything must fall into one of those two categories.
Mhm. Yeah. Again, I agree with all the above. I think the place to start would be probably to look at a personality disorder, with the caveat that as we might be ruling in for either a cluster or a specific personality disorder, including histrionic personality, that we must always rule out a larger illness. Right, so we'd be very, very careful not to arrive at a diagnosis of a personality disorder while there's another active mental disorder. So with that in mind, what appears to be presenting looks to be character traits that are incredibly maladaptive and resulting in clinically significant distress. And her impairment to function, right? She doesn't go on that trip,
Right.
right, to the dance competition. All right, 5 minutes left. Anything else you guys want to talk about?
We talk about Frank.
Anything you want?
Well, I guess this kind of ties into the whole end part of the movie. The part I kind of got lost was when Frank showed up as a real person. And
Yeah.
then
kids didn't understand whether or not he was actually there, or if we were like hallucinating, if we were all hallucinating together that he was there.
I wasn't sure to take it kind of like what Luke was saying earlier about how, like, he kind of saw this hallucination from the book before seeing the book. And then the same thing with Frank, maybe like he was kind of hallucinating this generic person, and then when he saw the face of Frank, there was something in the moment that he associated that face with his hallucinations, which is why he kind of, maybe impulsively, shot him.
But had then, when he saw him in the movie theater, did Frank also have the eye wound right where he shot him? I mean, I think that that's the writer director like telling us that this is science fiction, but that's just my take. I don't know.
And is Frank, Donnie's sister's boyfriend? Right, and how about Donnie's girlfriend?
Yeah, she
Gretchen.
shows up again too. She gets run over and then
We
at the
don't-
end of the movie, she's like there waving to like his family.
Because none of it ever happened. Yeah.
Yeah.
And she never met Donnie, and he saved her by going through the black hole. And then that's why he laughed at the end.
I think it was a wormhole, not a fact.
Well,
Yeah, I want both of you guys on call when I'm on. Anything else with Gretchen? Any other observations?
I mean, there's some shared delusion going on there, because if Donnie's having these delusions and she's then sharing them and believing him, and I don't know. Aspect of that, she probably has some aspect of PTSD, but
How come you say that?
well, I mean, just somebody with the trauma that she's had probably does, but there's no real like actual evidence that she does in the movie.
Yeah, I agree. I mean, she gives us a history, and that any behavior that we see that we might consider to be maladaptive, we have to keep that trauma history in mind. Yeah, so and it seems like it's certainly beyond 6 months, so it would be post-traumatic stress, so that would be high under differential. Final comments? All right, we're gonna stop it here. For those following at home, we'll be back with our case conference at 1:15. So we'll have a 1:15 start. So everybody has the link. We'll catch you back then. Thanks.